Assalamu alaikum, Army Public School and College Khanewal. It's class 10th biology lecture. Chapter number 13, sport and movement, and today is our last topic of this chapter, antagonistic movements of muscles and disorders. Let's start with the tendons and ligaments. What are the tendons and ligaments? Yesterday we discussed about the joints. There were different types of joints. Some were movable, immovable, and slightly movable joints. In joints, we have seen that two bones meet with each other at a certain point, and that point was known as the joints. Now we are going to see about the tendons and ligaments. What are the tendons? You can see here, this is a muscle, right? The muscle is attached here with the bone. The point where muscle attached with the bone is called the tendon. Tendon may also attach muscles to a structure such as the eyeball. A tendon serves to move the bone or structure. Yes, so obviously, in your leg muscles, you can see the muscles are there and the bones are also attached. See simply in your arm region. Here is your arm region. These are your bicep muscles, right? And they're attached with this bone. Here you can see this is your leg. Here, these are the muscles. These muscles are attached with these bones, right? And this is also one thigh bone to which these muscles are attached. So muscles are attached with bones, and that attachment is called the tendons. So tendons are clear to you?
Yes.
Basically, these tendons and ligaments are bands of connective tissues. As we are discussing about the bones and cartilage, they are also connective tissues. Hence, the tendons and ligaments are also bands of connective tissues. They are made up of collagen also, right? As you see that some cartilage were also made up of the collagen fibers, bones were having a dense form of collagen, right? In the same way, tendons and ligaments are also having what? Collagen in it. This is the composition of it. And what is ligament? This was the tendon that is attaching your bone with the muscle. And the ligament is a fibrous connective tissue which attaches bone to bone. When the two bones join with each other, that is called the ligament point, fine? And usually serves to hold structure together and keep them stable, and it makes your skeletal system stable. So these two terms clear. Let me show you with this diagram. Now it will clear more. Tendons bind muscles to bone. Here you can see these are the muscles, skeletal muscles, fine. And they are attached with these bones. So it is called the tendon. So tendon is here, okay? Next, ligament bind bone to bone. Here you can see these two bones are joined with each other, right? So joint capsule, the layer which is joining them is called the ligament. It is a band of connective tissues. So tendon and ligaments are clear to you, students?
Yes.
Okay, what is the function for the ligaments? They prevent dislocation of bones at joints. Obviously, when they are present, they don't let them to dislocate. They don't let them to slip over each other. They just give them the support and strength and keep them on their original position with the help of this ligaments. So two bones stay at its original position and they don't get dislocated just because of the presence of this ligament. That is a function of this ligament, right? Next, the topic is the muscles and movement. Yes, you are moving. Your muscles are also moving. Is it happening so? You are moving with the help of your skeletal muscles. The muscles which are attached to your bones are called the skeletal muscles, right? Here I am going to show you some antagonistic movements. What is that antagonistic movement? Before going towards that, you must know about the origin and insertion. If you see this diagram, you can see that the bone origin point and the bone insertion point. 2 points must be clear to you, students. Origin and insertion. What is that? One end of a skeletal muscle is always attached with some immovable bone. Fine. That this is the origin part where these bones are attached, right? This is called the origin of the bone, fine, where the immovable part. where its movement is free. At this point, you can move your elbow, right? You are moving here. This time, this is the insertion point where you can show the movement. At this time, this point is showing the movement. This is the insertion point, and the point which is fixed here, that is called the origin point. So origin and insertion is clear what it is. One end
Yes,
of a
miss.
skeletal muscle is always attached with some immovable bone. This end muscle is called the origin. On the other end of muscles attached with the movable bone and is called the insertion point. It varies with the conditions, right? So this time you can say this is the origin point and here it is the insertion point. Immovable, origin, movable, insertion. So got this point? The insertion and origin point.
Yes, ma'am.
Okay, what happened? I told you that insertion is giving movement, right? The free end. When a muscle is stimulated by a nerve impulse, your nerve impulse is giving you message that please contract your arm. Like this man is contracting his arm, right? He's contracting his arm. He got a stimulus. Wait a minute. Okay, class. I was telling you about the origin and insertion point, and one example was also there for you students. Let's suppose that if your muscles receive any message from the brain that contract your arm, right? What happened at that time? When a muscle is stimulated by a nerve impulse, it contracts to become shorter, right? It is getting shorter. The muscles are getting shorter. Here they are not short, right, in the relaxed condition, but here you can see these are becoming shorter. What happened at that time? And thicker. Due to this contraction, it pulls the movable bone at insertion. You can see these bones are moving, right? So what end moves? The insertion end moves. That is a movable end. At this time it is moving, and it is helping to shorten these muscles and to contract these muscles. Clear this point?
Yes.
Okay, next to, so the origin and insertion is clear to you students, right? That what is origin and what is insertion. The ligament and tendon is also clear to you. Now let's come towards this term that I mentioned here, antagonistic or antagonist, right? What it is? Okay, you can see here are two muscles present on this bone, right? This humerus bone is having two muscles. One muscle is present lower this bone, and one is present above of this bone. Two muscles are here. The upper muscles are called the biceps muscles, and the lower muscles are known as the tricep muscles. You can also see these muscles in your arm region. You can observe them. Just please contract your arm and check it that you are happy. You can see that your biceps are contracting and your lower triceps becomes relaxed. Is it happening so? You tried? Please, you can try it. You can feel this movement of contraction and relaxation, right? Now what happened, what I want to tell you about the antagonist. You can see that when there are two muscles present in one region, so we can say that this is antagonist pair. How? What is antagonist and how it can be an antagonist pair? How? Okay, let me tell you. When one muscle contract, the other relax, and this phenomena is known as the antagonism. You can see that here. You can see this muscle is relaxed in this condition. The bicep is relaxed. When you just relax your arm, the bicep is relaxed, but you can see this tricep, it is contracted. So at a time when one muscle relax and the other is contract, or when one muscles contract and the other is relaxed, this opposite movement is called antagonist. This phenomena is called the antagonism, and this action is antagonistic action. Is it clear?
Yes.
Okay. So one muscle is contracting, like you see when you contract your arm, the bicep is contracting and the tricep is relaxing. So this is opposite movement and known as the antagonistic action or antagonism. Okay, this term is clear. With this, let me tell you two things more, the flexor and the extensor. Flexion and extension, two things are also that is almost relevant to this part. Okay, when a muscle contract and bends the joint, it is known as a flexor. When a muscle contract, fine, you can see this is bicep, it is contracting, right? Its length is shortened now. It's mean it is contracting. So what I am telling you, when a muscles contract and bend the joints, it is known as flexor. Now its contracting condition is called the flexor muscle. At this time, this is extensor muscles, those who are in relaxed condition, right? Like tricep is in relaxed condition, so it is called the extensor muscle. The muscle which is contracting, it is called the flexor muscle. And the contracting mechanism is called the flexion, and the extensors muscles are called the in condition of extension. Is it clear also?
Yes, miss.
It's easy now.
Yes.
Okay, first I told you about the antagonism, where the two muscles have opposite job. One is contracting, other is relaxing. Is called the antagonistic movement, right? After that, I told you about the flexor muscles and the extensor muscles. The muscles which are showing the contraction are called the flexor muscles, and those who are relaxed are called the extensor muscles. And both this mechanism phenomena of flexor muscle is called the flexion, and the movement of this extensor muscle is called the extension. So antagonism, flexor, extensor, flexion, and extension, all these terms are clear to you. Am I right?
Yes, ma'am.
Okay,
Yes.
now I'm going to give you one example of your muscles, like all already it is given, right? You can see here biceps contracted, right? You can see the biceps contracted, triceps relaxed or extended. It is called the extension also for this, for tricep, and for the bicep it is called the flexion. And here, what is flexion? Now tell me in this diagram that I'm highlighting with this arrow, please let me know that biceps is this point is flex. What type of movements are here? Flexion or extension? Tell me.
Extension.
Very good. And here, flexion. Okay.
Flexion.
Now come towards the bicep is a flexor muscle. Yes, we know bicep is a flexor muscle when it is contracting. Okay. While the tricep is an extensor muscles or of arm. Both these muscles have their origin at pectoral girdle. What is a pectoral girdle? This is the shoulder girdle, right? They are attached with here. You can see this is a muscle movement and they are attached with your pectoral girdle. Same, this lower muscle is also attached with the pectoral girdle, right? And insertion at one of the two bones of forearm. When biceps contract, fine, the forearm main insertion end is pulled upward. Obviously, when your forearm, when you are contracting it, this insertion point is pulled upward, right? It is a flexion of elbow joint, right? It is called the flexion of elbow joint. During this flexion, tricep muscles relax. Here, of course, these muscles are relaxing this time. Tricep muscles relax. When tricep muscles contract, when we take its opposite here, when tricep muscles contract, forearm is pulled down. It is pulled down, right? Now what happened here? It is the extension at elbow joint. It is called the extension here at elbow joint. During it, bicep muscles what? They relax. In this way, bicep and triceps make up an antagonistic pair of muscles, similar pair working antagonistically across other joints, provide for almost all the movements of the skeleton. Hence, you can say that all the muscles that are showing the movements, they are following the same pattern of the antagonistic movement. Clear?
Yes.
If you see in your legs, the legs are also containing the same bones, right? Two bones in the lower leg, and in upper leg there is one thigh bone, and same muscles are attached there also. When you move your legs, they also contract and relax. There are also upper and lower muscles. They are having their different names. They are also showing the antagonistic, same like happening here in your arm region. It's mean all the skeletal muscles are showing this antagonistic movements. If you are having any confusion here, please ask me. Do you have any confusion here? Or should I move ahead?
No, ma'am.
Okay, now let's see the next. We are going towards the disorder of skeletal system. When these are actually the disorder of your skeletal system, that can be of the bone and the cartilage. The following disorder of skeletal system are important that I am discussing with you students. Now, the first is the osteoporosis. Osteo means bones and process means that your bones becomes a porous, right? Which literally means porous bone is a disease in which the density and quality of bones are reduced. where you can find this problem. It actually takes place in old people, right? Their bones become old and they becomes a porous. And the porous bones become very, you can say, soft, and they can be brittle easily. In osteoporosis, there is a decrease in the density of bones. Of course, you can see here. This is the normal bone, less porous. And this is the osteoporosis bone. You can see here, so many pores are here. That's why it becomes very soft. As bone becomes more porous and fragile, the risk of fracture is greatly increased. If an old person's fall on the road or somewhere else, he's having maximum chance of fracture in the bone. The loss of bone occurs silently and progressively. Often there are no symptoms until the first fractures occur. Okay, now let me tell you about about how this problem take place. What can be the causes for this problem, the osteoporosis? Why the bones becomes a porous? The question is here. I told you that the density of bones becomes less. Why? Because your bones lose the calcium and phosphorus. This is the main ingredient of your bones. When the bone loses the calcium and phosphorus from it, it becomes soft. Okay. And other things that can be the responsible for osteoporosis are malnutrition. Do you remember the malnutrition in your 9th class? Lack of the problems related to the nutrition are called
Yes.
the malnutrition. Yes. Here, osteoporosis can be caused by the malnutrition, lack of physical activity, or deficiency of one hormone, estrogen. In old age, there is decreased secretion of growth hormone, and it also leads to decreased deposition of minerals in bone matrix. And one thing, growth hormone is also responsible that within the age, it is not working like that. Hence, it is causing the osteoporosis. So what can be the causes? You can count here. Number 1, reduced level of calcium and phosphorus. Number 2, malnutrition of vitamin C and proteins. Lack of physical activities, deficiency of estrogen hormone. So these are the certain causes responsible for the osteoporosis. Are you done with this?
Yes.
Next to it is the
Yes.
arthritis. Arthritis means inflammation in joints. Like here you can see one joint is here. The inflammation, the swelling take place here, and it causes a problem called the arthritis. It is also common in old age and in women. What happened in it? What you feel in arthritis? Pain and stiffness in joints. Your joints become very stiff, strict, strengthened, right? Particularly in weight-bearing joints, like where you wear a lot of weight. Of course, your body weight leaves over here, your hip joints, and on your this knee and foot joints, ankle joint, right? Here your maximum weight comes of your body. That's why the arthritis is mostly found in these regions. The main symptoms of arthritis are joint pain and stiffness, which typically worsen with age. The most common type of arthritis are osteoarthritis, rheumatoid arthritis, and one more is here, gout. I'm going to tell you all this one by one. So let's see first the osteoarthritis. As I told you, arthritis is the inflammation of joints, inflammation in joints. Now let me tell you, this inflammation can be because of certain factors. Certain factors are involved here that is causing the different disease. If we see, the osteoarthritis is the most common form of arthritis affecting millions of people worldwide. It occurs when the protective cartilage. Okay, now please remember this thing, that this osteoarthritis, if you remember, between two bones, we said there is a joint. Joint is a point where two bones are meeting with each other. And at their meeting point, there was also one layer of cartilage presence, right? At joint point, when there is a cartilage, protective cartilage that cushions the ends of your bones, wears down over time. When this cartilage get degenerate from the joint point is called the osteoarthritis, right? So basically what happened here, the two bones are meeting with each other, that is called a joint, and joint is having on both bones one cartilage. When this cartilage get degenerate, it causes the osteoarthritis. Got it?
Yes.
Fine. Here you can see, right? This is these two bones are meeting with each other at a point called the joint, a joint with mild osteoarthritis. What happened here? This is a cartilage, right? And you can see here that it is this is roughened, thinning cartilage. The cartilage is getting very thin. When it becomes totally thin, what happened? It will cause the inflammation here, and this inflammation makes a problem called the osteoarthritis disorder. Got it now? Clear? What happened when this cartilage becomes degenerate? What can be happen? You know that your bones let a free movement, like they are showing at this point is giving you a forth and back movement. Now whenever you will move this joint, two bones will move, this point creates pain in there because there is less lubrication, because the cartilage has got degenerated. In this arthritis, fusion of the bones at joint may occur and joint may become totally immovable. When you can see that this membrane is also degenerated, this membrane is also, what happened that these two bones will meet with each other and they can tightly be packed. Might be possible you can't move your this joint. Why? Because there is no gap between them. There is no cartilage between them. Can you move now? Can you move your joints without this gap? No, you can't do this. So it is called the osteoarthritis. Next to it is the types of arthritis are here given. Rheumatoid arthritis, right? The next one is the rheumatoid. In first you have seen that was a disorder of cartilage dissolved here, right? The cartilage is getting disappeared and hence it is causing the osteoarthritis. If we talk about the rheumatoid arthritis, what happened here? It involves the inflammation of the membrane at joints. You can see this diagram. One membrane is also present here. Not showing here, but there is also one membrane over this cartilage. Fine. One membrane is also present here, and this membrane, if this membrane get disappear from here, it also causes the inflammation, and the inflammation that is caused by degraded cartilage. Yes, you can see here swollen inflamed synovial membrane. This is the membrane, you can see it here. Fine. So synovial membrane is also swollen and inflamed. It's mean it is also tightening these two bones, right? It is not letting them to move freely. So what happened that these two bones now are fixed with each other and they can't move. This is called the rheumatoid arthritis. So what is the difference between rheumatoid and osteoarthritis? In osteo, there was cartilage problem present on two joints, right? And here is the problem of membrane which is present on two joints. Got it? I am moving towards the next problem, that is the gout, which is the third type of this arthritis. What happened in this disease, you can see here. This joint point, right, on toe, you can see here. What happened here, you can see the crystals. These are the uric acid crystals. It is characterized by the accumulation of uric acid crystals in movable joints. Can you move your thumb? Can you move, please?
Yes.
Yes, you can move it freely. But when a problem like gout comes, you can't move it just because the accumulation of these uric acid crystals here. It generally attack the toe joints. You can see here, this is your feet, toe joints, which are being impacted by this gout because of this uric acid crystals. So till here, hopefully your arthritis and osteoporosis is done, and you are also having a good understanding of it. Oh, is it okay?
Yes.
Okay.
The difference with that